Hello, my name is Michael West. I'm Senior Visiting Fellow in the King's Fund in London and Professor of Organisational Psychology at Lancaster University. I want to describe what we mean by compassionate leadership in social care across Wales. It means four behaviours: attending to those we lead, understanding the challenges they face, empathising with them, and then helping them. Attending means paying attention to those we lead, being present with them, listening to them with fascination, and given the pressure that social care staff are under, then seeking to understand the challenges they face, not by imposing our understanding from a hierarchical position afar, but through a dialogue to arrive at a shared understanding of the challenges they face in their work. And third, it's having an empathic, feeling, caring response, feeling the pressure they're under, feeling the anxieties, feeling sometimes the sense of inadequacy that staff may have. And that gives us the motivation for the fourth element of compassion, which is helping or serving those we lead. And that's achieved by helping to remove the obstacles that get in the way of them doing their work effectively, and helping to find the resources they need, the right numbers of staff with the right skills, the right equipment and technologies, computing, and the right training and development to give them the skills that they need to do their jobs effectively. And those four leadership behaviors that constitute compassionate leadership, we have known for the last 60 years are key to effective leadership and to team effectiveness and organizational effectiveness. But this is not some soft cushion scented candles approach to leadership. On the contrary, compassionate leadership requires a great deal more courage and authenticity than the rather easy opt-out of command and control leadership, because our compassion ultimately as leaders is for the people of Wales that we serve, the communities we serve. And so that entails a very strong focus on performance and performance management in a compassionate way. And also, it's not some easy consensus way forward. It's ensuring that we are doing what's best in our social care settings to enable us to provide high quality care and support for the people and the communities we serve. So it's about ensuring that leadership is effective by creating an inspiring sense of vision or direction, which is a daily beacon that guides our decision making hour by hour and moment by moment, ensuring alignment of people's efforts within our teams and organizations by making sure there are clear goals and that people are coordinating their work effectively, and by creating a sense of a feeling of trust and commitment across our teams and organizations. And it's about also ensuring inclusive leadership. If leadership is not inclusive, then it's not compassionate. So ensuring that everybody feels included by our leadership, regardless of their professional background or their gender or their ethnicity or their nationality. Because inclusion and compassion are in a sense two sides to the same coin. They are about blurring the boundaries between self and other and creating a sense of connection and safety and support. And compassionate leadership is also about being collective, about sharing power and enabling all to feel they have leadership rights and responsibilities. And that means encouraging shared leadership in teams. So we may have a hierarchical team leader, but the leader's role is to bring everybody's contribution and knowledge to bear on delivering high quality care for the people and the communities we serve. And compassionate leadership is also about working compassionately and helpfully across boundaries with the other teams and organizations and sectors we work with, prioritizing overall the delivery of high quality care for the communities that we serve, and always asking the question of other teams and organizations, how can we help you? So compassionate leadership is core to creating the cultures we need in transforming health and social care across Wales for the coming years for the benefit of the people and the communities all across the country.